Thank you for joining me today. In this video, you will learn more about Ramelteon. Ramelteon is a sleep medication and it treats insomnia. Ramelteon is for sleep and sleep-onset insomnia. I have a case study based on Ramelteon. A 34 years old female presented to a primary care clinic with concern about chronic difficulty. She has a chronic and she has a difficulty for falling asleep. She works routine shifts as a healthcare administrator and reports sleep problem for approximately 6 months. So 6 months she has this issue. Past medical history is significant only for mild seasonal allergy. So she only had a seasonal allergy. She has no history of a depression, anxiety disorder, substance use disorder, or sleep apnea. She is not pregnant or taking any other medication. Especially she is not taking loratadine as needed. No prior use of prescription sleeping medication. She never had those. Symptoms she presented with include difficulty initiating sleep. Often she lays awake 2 hours. She goes to the bed and she lays there 2 hours trying to sleep. She has a restlessness and frustration at the bedtime. She has a daytime fatigue without excessive sleeplessness, inconsistent sleep schedule due to work demands. She denies frequent nighttime wakefulness, especially morning awakeness, snoring, witnessed insomnia. But insomnia, she don't have insomnia. She don't have restless leg syndrome because restless leg syndrome can keep the person awake. So she don't have that. She has attempted sleep hygiene measures include limiting caffeine. She limit the caffeine, but she still have that insomnia. She maintain bedtime routine and she still have that insomnia with no improvement. So clinical assessment, physical examination is unremarkable. So she don't have any chronic issue. She don't have no mental issue, and mental status exam shows the normal mood, affect, and cognition. Sleeping screening tools are negative for depression and anxiety. Clinical presentation is consistent with chronic sleep onset of insomnia, likely related to circadian rhythm disturbance. So that's what she has. The reason is you will choose Ramelteon is for this medication is because the patient primarily issue is a difficulty falling asleep rather than a fragmental awakeness. This medication targets melatonin receptors in the brain, supporting a natural sleep-wake regulation. It is non-sedative, non-habit forming, and not controlled substance. This medication is not controlled substance, it's not habit forming, and it's not sedative. Prefer over the hyponic medication due to no risk of a depression, tolerance, and rebound insomnia. So this medication don't have a risk of a dependency or tolerance or rebound insomnia. It don't cost you. When you stop the medication, you will not get insomnia again. That's what it's called, rebound insomnia. And it's appropriate for long-term use in a patient where the insomnia has circadian rhythm component. After sharing the decision making with the patient, Ramelteon was initiated for nighttime use only. You will educate the patient about taking the reason they take this medication is helping regulate the sleep-wake cycle and improve sleep onset. You will educate the patient about how to take this medication. They should take the medication 30 minutes before bed. Avoid taking with or immediately after a high-fat meal, which can delay the absorption. Taking a high-fat meal will delay the absorption of this medication. What to expect? You will teach the patient what to expect. Sedative may take several nights to notice the benefit. So this medication takes a long time to be effective, to see the result of what you are hoping for. Works best with consistent bedtime routine. Common side effects of this medication include dizziness, fatigue, nausea, and headache. Safety profile include no risk of dependency or withdrawal. So this medication don't have risk of dependency or withdrawal or tolerance. Safe for next day functioning in most patients. You can work normally and be active. Next day it won't affect you. You will not be groggy or sleepwalking next day. Patient demonstrate understanding and agree with the treatment plan. That's what you want to see, if they understand what you are teaching them and they agree the treatment plan. Clinical monitoring include sleep onset and total sleep time. You want to monitor the total sleep time and sleep consistency, if they are sleeping consistently. Daytime alertness and function. That's when you want to monitor. You want to monitor adverse effects such as dizziness and fatigue. No lab routine required for healthy adults who are taking this medication. You want to do baseline liver function test. Consider if a history of hepatic impairment or long-term use is anticipated. Avoid use in a patient with severe liver impairment. So patients who have a liver impairment, they shouldn't be taking this medication. treatment outcome that the patient will hoping to gain. It takes 6 weeks, and then you will set up a follow-up appointment for 6 weeks visit, and you want to monitor after that 6 weeks. They've been taking the medication 6 weeks, and you have a follow-up appointment with the patient. You want to see them fall asleep within 30 minutes of taking this medication on the most nights. You want to see improve the consistency in a sleep schedule. You want to see a reduced bedtime anxiety related to sleep initiation. You want to see improve the daytime energy. So when she came back 6 weeks, she denied next day sedation, she denied dizziness, she also denies cognitive impairment, no side effects were reported, and she take the medication as needed. Follow-up plan include continue this medication nightly at the current dose, because you see improvement on this medication. You want to reinforce sleep hygiene and circadian based strategy, include considering bedtime and light exposure management. You want to educate them and reinforce that. You want to reassess the sleep quality, function status. You want to also continue need for medication in 8 weeks. Consider behavior therapy for insomnia if the symptom is continuous. You will instruct the patient to follow up earlier if the sleep worsens or the side effects develop. You want to encourage them to come. Don't wait the follow-up appointment that we sit together, but if you see symptoms or issue, or your sleep is not improving, or you need to take more medication, come back and we can see you sooner than the appointment we set up together. Thank you for joining me today. Please subscribe and join me in my next video. Thank you.